what we're dealing with here is a situation where, as the department, we must stay ahead of the surge. We're watching and looking at the trends, and certainly, I think in the country, Gauteng is still at the top of the rate of infection. KZN is taking over now, and therefore we're going to be discussing with them how to move ahead so that they don't get caught up with the numbers. It should be possible to make sure that whoever the patients that they have to admit, they don't have a challenge with beds, with oxygen, and that the turnaround times also are reduced. With all of that, I'm quite comfortable with the approach. Our clinicians are quite on top of the game, and they've got good enough experience, and we can see the impact. And so from that point of view, I think we're going to get somewhere. So today, basically, what we are really up to is to just see how things are kind of tying up in terms of additional beds being available, so that no one should be turned at the gate to be told that there's no bed available for you. There are those who may not be admitted. That's because of the doctor's decision. So when the doctors decide that you don't admit the patient, that's it. That patient will not be admitted. And so it will not necessarily should not be because there's no space. It will be because the judgment, the clinical judgment is that you're going to be treated somewhere else, not in the hospital. So I'm quite comfortable with that. And I also think that the reduction of trauma patients is a huge advantage for us. It's going to help us to deal with the next few weeks. And so that's it. We'll be going around just to make sure that Gauteng is able to show readiness. And we've got a team that you must have their number as well. If you guys feel you have a problem, they must also come and support you. They are the emergency intervention team, which basically deals with the infrastructural issues. They were here when you had to deal with the thing on the Saturday with oxygen fittings. That group will always come in just to unblock certain areas, but they're actually helping the MEC and the department on the increasing beds in all the hospitals. Whatever we thought at the beginning was necessary, we're going to have to open up and increase the numbers more, so that there's never going to be a time when there's pressure on any hospital. So that team will continue to do their work. But in the meantime, I want to say thank you to all of you, the clinicians, the nurses, the doctors, the emergency rescue services, and the management, as well as the provincial department. I can see that you are really beginning to gel together. It happens like this everywhere. Until the surge hits you, you don't know how to behave. You will only know when you're actually in the heat of it that this is where. That's the experience I got when we were dealing with the Western Cape. And by the way, MEC, you can't run out of beds completely. The private sector, whilst it's got its own beds, but we've got a standing agreement that you'll shift to the private sector. Any patient, particularly for high care and intensive care, you'll shift them. And those patients will be dealt with on the basis of...
So that's the Minister of Health there, Dr. Zweli Mkhize, addressing some of the clinicians and medical staff on a visit to some of the facilities here in Gauteng.